Hi there, Steve from Northeast Functional Health. We're going to be talking a little bit today about how old injuries can affect you. Because a lot of people are either disbelieving or a little bit confused when I kind of say, oh look, when you broke your elbow at the age of 5 that you told me about, like, I can see something, I can find something there which is affecting your shoulder or your neck. Now, as I kind of spoke about in the previous video, even when tissue has healed itself within, let's say, 2 to 4 months of injury, the brain can go on protecting that area and as if it's still injured. It will go on guarding it. And when you return to normal use, if the brain perceives there's an issue there, even though you're using it, it'll just rev things up. It's more likely that you will experience pain. Now, I was working with a lady either side of Christmas who is in her 50s. She had spent the majority of 30 years sat in a desk job. Recently, she had changed job and she's now a woodworker. So she was spending a lot of time carving things, working with a draw knife, and over a period of a few months, she started developing elbow pain on both sides and wrist pain on both sides. And when going through her history, she kind of said that when she was in her late teens or early 20s, she broke her left collarbone. And in her 20s as well, she had a lot of left-sided neck pain, which she'd received treatment for, and everything seemingly with her shoulder was fine now. Now, over the course of treatment, I believe I saw this lady between 3 and 5 times, I can't exactly remember off the top of my head. We treated a lot around that left collarbone because the brain was protecting it, because that area was still hypersensitive. And the reason that it had taken, she asked me, is like, how is it that I've gone along for 30 years, been absolutely fine, why is it that my collarbone is now causing this pain? Or causing the pain in my elbows and wrists? And theoretically, or kind of this is best working theory, is when you're sat at a desk doing this, it doesn't matter, you might be moving a mouse, you might be picking up a phone, however, it's far less physically demanding than doing a physical job where you're using, you're gripping, you're pulling a lot with a draw knife and kind of carving things out. The difference in those activity levels was obviously enough to actually rev up the thing that she was still guarding around her collarbone, and ended up as pain in elbows and wrists. We found that over the course of the treatment, with all the kind of work we did around her neck and her collarbone, that we managed to resolve her treatment in elbows and wrists by doing very, very little other than stuff around this side, and I seem to remember something with her left elbow that she'd injured as well. All the pain that she was experiencing through her elbows and wrists was just effectively noise, because her system was unhappy with something that she was continually aggravating, which it still perceived as injured. Now, when you can identify and treat these root causes, things change, and they will stay changed unless there is something higher up the food chain that is more important that you need to go and find, or unless the trigger to keep it coming back. So one of the things that we're always doing with people is checking for triggers, and we'll talk about those in the next video.